we have Nick Bowden today. Nick is a senior research fellow at the Department of Pediatrics and Child Health at the University of Otago. He's a quantitative social scientist specializing in child health research using linked population level data. In particular, he is interested in the intersection between health and non-health outcomes for children and young people with neurodevelopmental, mental health, and other chronic health conditions. He's passionate about research that can inform evidence-based policy and health delivery change to address inequities in Aotearoa New Zealand. And I was just reminiscing with Nick with the fact that when we first encountered him in around 2009, working on a project enhancing hospital outcomes with looking at things like ambulatory sensitive hospitalizations and Elix-Hauser comorbidities and various pieces of coding for medical conditions. And we're still using pieces of code that he's written to identify mental health diagnoses and things like that. So we've all been around a long time. And with that, I'll hand on to you, Nick. Thanks.
Awesome. Thank you, Martin. Kia ora, everybody. Thank you for having me here today, and thank you for coming. And I see a lot of familiar names online, including people that have contributed to maybe not specifically this paper, but the sort of program of work that we've done around autism over the last few years. So today I'm going to base my talk around a paper that was recently published looking at school attendance among autistic students in New Zealand. So before I start, I just usually like to touch on these two things. The first point around language, where as a research team, we recognise that there's no one set of terms that are preferred by all people from either the autistic or autism communities. But in partnership with the co-authors on this particular paper, and in recognition of sort of changing preferences over time, we tend to follow these guidelines here that were written or led by Ruth Monk and with Autism New Zealand, and more specifically use the term autistic person throughout. And the second point here is around community involvement in our research. I think, or at least I hope, that this has been one of the real strengths of the program of research that we've done over the last 7 years, and certainly very important to me. So on this study, we're particularly fortunate to have members of both the autistic and autism communities involved as co-authors, the former being autistic people and the latter being either whānau of autistic people or people who work closely with autistic people in a professional capacity. So I think we're really privileged on this particular paper to have quite a well-rounded multidisciplinary team of researchers. And in my view, really important when we're working with population level data, particularly with an autism focus, because while I think we all know that there are a lot of strengths of using population level data in the IDI, it often lacks the nuanced detail that we'd like. And so it's really important to have community involvement, both in the development stage of projects right through to, in particular, the interpretation of findings. So by way of a very quick introduction of autism, it's a neurodevelopmental condition classified now in the DSM-5 as a single diagnosis of autism spectrum disorder. The most recent prevalence estimates out of the United States suggest that approximately 1 in 31 children are autistic. So again, in the context of education research, it's getting, I guess, at or very close to, on average, one autistic child in every classroom. It's clinically characterized by differences in social communication and interaction, alongside restrictive, repetitive behaviors or interests and a range of sensory sensitivities. But contemporary interpretations of autism also view it through a strengths-based lens. So things like really good attention to detail, deep focus on areas of interest, strong memory skills, unique problem-solving approaches, and just, I guess, generally a unique view of the world. And all of those things, I guess, from my perspective, I've seen in particular brought through to our research from various members of the autistic community, which we're very fortunate to work with. Overall, I think, though, and a colleague here, I see that I heard this phrase from the first time, online. Hillary said to me, when you've met one person with autism, you've only met one person with autism. And the idea was there really is that just how differently autism presents across people. And then in addition to that varying complexity of the way autism presents, it's also complicated by the range of co-occurring conditions that are more common for autistic people. So they include both physical and mental health conditions. And so I think all of this is really important to keep in mind when we're considering school attendance for autistic children. So the background to this study, I guess, firstly, is that school attendance is a very important and strong predictor of not only educational success, but also outcomes across the life course. So, for example, in the labour market and into the criminal justice system. At the population level, New Zealand school attendance rates are fairly low by international standards and have generally been declining back to about 2015. For these reasons, it's considered a priority area for government in New Zealand. There was a select committee inquiry into declining attendance in 2021, which, among other things, resulted in the establishment of the attendance and engagement strategy. For autistic students, though, there are a range of additional challenges for attending school. So some of these arise at the transition into primary school, where that change of routine, the new physical environment, the new social environment can all lead to heightened anxiety among autistic students and ultimately can lead to school refusal. There are the medical related issues that I touched on before. So quite a lot of medical absence. There's a lot of sensory challenges for autistic students, particularly in modern day open plan learning environments. There's a lot of kids in the class, a lot of noise, a lot of things happening. And sometimes this can get quite overwhelming for autistic students and can lead to challenging situations and behaviours. And finally, bullying has also been recognised a lot in the literature as a major reason why autistic students might refuse to go to school. Despite all this, though, there's a surprising lack of existing research into school attendance for autistic students, certainly using population level data and also in New Zealand. A lot of the information out there is based on self-report survey data, either from parents or teachers. And so the overall aim of this study was fairly simple. It was to use population level data to examine school attendance rates among autistic compared to non-autistic students, including by age and sex, with a secondary aim to explore the types of non-attendance. So just to give you a little bit more context of where we're at in New Zealand with school attendance, this figure here shows rates of regular school attendance in New Zealand by year for the term 4. So regular school attendance is I guess probably the most standard metric of school attendance. It's the one you probably hear most about in the media. And the definition is that students need to be attending more than 90% of school half days to be classified as attending school regularly. So you can see here from the numbers, not once in the last 6 years has New Zealand had more than 2/3 of students attending school regularly. Numbers have tracked up a little bit since 2022, but as I mentioned before, they're pretty low by international standards. So for comparison, England's attendance rates in 2022 was 76% and USA was 70%. And of course, these data are at the population level, and our hypothesis for this paper was that autistic students would be attending school even less regularly than the general school population. And so our view with this paper was that to have any chance of improving school attendance to the rates that have been targeted by the current government. So I believe the current target rates are still 70% by 2026 and 75% by 2030, that a real emphasis will need to be put on supporting learners with diverse learning needs, including autistic students. But in order to sort of set the scene for that, we need some baseline evidence. So hence the study. So By way of a quick overview of the methods that we employed in this study, again, a really simple design. It's a national retrospective cohort study using linked health and education data in the IDI. Participant population was all students enrolled age 5 to 16 in the 2018 calendar year. So a little bit dated already and a bit of a long story why we're going for that far back. But in any case, one school year of data. The key variables in the study included the identification of autism. So this was from a piece of work we did back in 2020, a simple method that draws on 3 health data sets in the IDI and diagnosis information contained within them. So we use hospital admissions data from NNDS, specialty mental health service use data from Primed, and then the main one really is diagnosis information contained within disability support services data in a data set called Socrates. So I think as most of you all know, we don't have diagnosis information from primary care in the IDI. We don't have diagnosis information from outpatient settings. So on the sort of care pathway from diagnosis for autistic young people, the first point of contact that we have in the IDI with a recorded diagnosis is when these young people get referred to disability support services for a needs assessment. And so I guess that highlights one of the limitations of this study and our method of identifying the autistic cohorts is that it will undercount autism to some extent. And certainly we know we of course aren't capturing undiagnosed cases, but even still we feel like we're probably capturing certainly the majority of autistic young people in New Zealand. The outcome measure, as I mentioned before, was the metric of regular school attendance, so attending more than 90% of half days. And then we calculated incident rate ratios for regular school attendance using 2-level random intercept modified Poisson regression models, so students nested within schools. We ran that analysis at the overall population level, but also stratified by sex and by age. I just wanted to, I guess, talk a little bit more about attendance data in the IDI, not necessarily specific to this study, but more generally, I guess, for anybody that might be interested in using them. My understanding is that attendance data exists from 2011, but coverage wasn't very good until around 2015, 2016. At that time, schools were reporting attendance information for term 2 only. But from 2019 onwards, data is collected from schools across all 4 terms. So I think the general rule of thumb is to not use school attendance data prior to 2015 or 2016. The attendance data itself is collected by schools at an individual level, both in the morning and in the afternoon. So that's the half-day measures. So in theory, you have for every student in New Zealand, 2 observations of attendance data for every day of the school year. And in addition to that, the information that's recorded there includes, of course, whether they attended school or whether they didn't, but then there's 15 different attendance type codes, which provides a bit more detail into the type of attendance or the type of non-attendance. So this is a huge data set. I think it feels like it's the biggest data set that I've ever used in the IDI. And because of that, really cumbersome to use. Thankfully, some kind folk have put together a code module which is available for anybody to use. So I'd sort of strongly encourage anybody who's thinking about using the attendance data to use the code module. As with all code modules, it's refreshed or rerun every IDI refresh. And for the school attendance code module, there's 3 tables of data that are created. So you get an annual level data set, so 1 observation per student per year, a term level data set, and then the more granular half-day data. So in terms of results for our study, overall, our cohort had just over 650,000 students, of whom about 8,500 were identified as autistic. So that's about 1.3 The participant population there described by the different socio-demographics in that table, you can see males overrepresented in the autistic group at approximately what the ratio we would expect based on international evidence. Also some interesting differences by ethnicity too, with Māori, Pacific and Asian students underrepresented in the autism group. In terms of the main findings, the overall observed rate of regular attendance for autistic students was 55%, and that compared to 63% for non-autistic students. And then you can see from the figure there that the adjusted incident rate ratios at the overall level and for stratified analyses by sex and age all indicated significantly lower rate of regular attendance for autistic students compared to their non-autistic peers. The gap is the greatest for the youngest students, so those aged 5 to 11, perhaps reflecting some of the challenges associated with that transition phase into school. Perhaps also that the primary school environment is quite a lot more, I guess, chaotic than secondary school, and may also be that by the time autistic students get through to secondary school, they've learnt some strategies to cope with some of the challenges they faced, and also that schools may hopefully have learnt to work with them and make accommodations and provide appropriate levels of support. In terms of reason for non-attendance, I wanted to preface this quick discussion with, I guess, some concerns that were raised by our authorship group around how accurate this coding might be, particularly for autistic students. There are, I guess, good reasons there are reasons from both the perspective of parents and whānau and from the school as to why it might be easier to try to get non-attendance coded as justified absence. So there's two main categories there. On the left-hand side, you see the overall aggregate justified absence category, and in the middle there is the unjustified absence category. To the right of each of those aggregate categories are some of the subcategories within them. So you can see there that the greatest difference is with justified absence, and that each of the subcategories there are statistically significantly different, with medical absence quite a lot higher for autistic students, which again, on the face of it, wouldn't seem surprising given the higher levels of co-occurring conditions. The one that says justified absence, that's actually justified other, and it's a composite group of a whole bunch of different reasons why a student might be justified as being absent. One of those is something called a well-being plan, where the official definition of that is that a parent can request, and then the schools have to agree with the whānau to reduce the students' hours of attendance at school to help meet the students' well-being needs. So that one there, obviously higher, and also a little harder to see because the magnitude is a bit smaller, but autistic students significantly more likely to be stood down or suspended, which is classified as a justified absence, but in reality might often not be the case. So I guess in the paper we argue that disparities in attendance between autistic and non-autistic students signals some systemic gaps in meeting the needs of autistic learners. We highlight the importance of strengthening teacher professional development, creating autism-informed learning environments, and ensuring equitable access to individualized supports as things which could help improve school attendance. Despite government strategies to improve school attendance at the macro level, there is really a lack of explicit consideration for strategies to improve school attendance for students with disabilities. and of course that includes autistic learners, which we think reflects a pretty big oversight. And again, if government is wanting to target those improved rates of school attendance over time, then putting in place specific strategies to help learners with different needs is going to be critical. So I guess our last point here is that we do see this as a bit of an opportunity. I think by providing a bit of an evidence base for people to work off, there's an opportunity here to embed more inclusive evidence-based approaches into improving school attendance. So I just finish off with, I guess, some thoughts on future work. We very much recognise that this is a very simple first baseline piece of work. So we do have a range of other ideas in mind to expand on it. The first is to look at the spectrum of neurodevelopmental conditions. So this would include things like ADHD, intellectual disability, and other learning and communication conditions. We'd like to include looking at other metrics of school non-attendance as well. So we talked today about regular school attendance, but there are other categorizations that include non-attendance at sort of chronic absence, for example, at less than 70%, and others in between. And most importantly, in this particular piece of work, we're aiming to include a mixed methods study design. So the IDI piece of work will create the evidence base, but the qualitative study where we will engage with neurodiverse learners, recent school leavers, as well as parents, whānau, teachers, schools, and attendance practitioners to help interpret what that all means, but most importantly, to try to hone in on some of the enablers and barriers to school attendance. I'd really like to do some work around the impact of early diagnosis and early supports on improving school attendance. So I think we still have an average age of diagnosis of autism in New Zealand at about 6 years old. Internationally, the evidence says the earlier you can diagnose, the earlier you can support, and the better the outcomes for both the child and the family. So there's the opportunity to use the IDI to explore how school, or if school attendance is improved, if a diagnosis and supports are obtained earlier. And then lastly, to look at the wider impact of school non-attendance on whānau as well. So we have an existing piece of work that shows that household labour market participation and household income is significantly affected for families that have an autistic child. What would be interesting to look at is to see the extent to which school non-attendance contributes to disparities in income as well.
I'd just like to start by saying thanks for that. And it was really interesting to hear about the idea of the education data and only collecting term 2 up until 2016 or whenever it was, because we've encountered that recently looking at refugee populations for another study. And even with a much smaller population, the daily attendance data that you get out ended up being, we had a data set of 800 and something million rows, as you say, a much larger data set than normal. And you can very quickly annoy Stats New Zealand by having that in the IDI sandpit. Hillary, a primary school principal, recently told me that she would like a new code ND for autistic and ND kids, as their attendance is more complicated than justified or not justified or even medical. Could be school refusal, bullying, or only part-time attendance because the school doesn't have enough support for a full day, or any other reason, despite the parent trying hard to get them to school. What do you think about that for coding?
Yeah, thanks, Hillary. And yeah, look, like I was trying to get at some of that, I guess, in my discussion around, or prefacing the discussion around how reliably we can interpret those attendance type codes, because there's the families that I've talked to, it's certainly not as simple as that. So I guess what I would say in terms of coding, it's a challenging one within education, right? Because on the one hand, they I guess in theory they say that kids don't need a diagnosis in order to get supports, and so that's the argument for not including diagnosis information on educational records, um, which I think is a good thing in terms of, supports are provided based on need rather than obtaining a diagnosis or not. But the reality is that having a diagnosis is what often kicks off discussions around support. So I would agree with you. I'd love to see them include both diagnosis information of children on educational records and somehow include more nuanced information around attendance type or non-attendance type. I still worry how reliable that would be if they did, because everything that I hear suggests that reasons for non-attendance are very complicated, and being honest about those can be a challenge. So one of the, I guess that's one of the main reasons why we want to do this qualitative study, right? Is to really get to the bottom, or try and get to the bottom of what's actually going on.
MC, thanks for the interesting presentation, Nick. How many years of NMDS primed Socrates data have you used to capture the autistic population? Someone may be diagnosed several years before the 2018 attendance data. Also, I assume people that are referred to DSS are likely the more severe cases, and there may also be referral differences across different demographics. Maybe lower referrals for non-Europeans. Your dataset identified 1.3%, which is lower than survey results, and US data, which is at 3%. How confident are you that you have captured a representative sample of the autistic community, and whether there are any plans to refine the autistic population further? And you did mention 1 in 31, as in 1 in every classroom, which is around about more like 3%, isn't it?
Yeah, that's right. So it's a really good question. I guess just going through it. So what I neglected to say, we looked at lifetime diagnosis. So we do look as far back as we can. So NMDS goes back. We look at NMDS back to 1992. Primed and its predecessor MHIN goes back to 2000, and Socrates pretty much from 2011. So it's not a lifetime for across all of those data sets for all of the students in the population, but we do look back prior to 2018. Yeah, the extent to which we capture the true population is really an unknown. To be honest, we don't really have any reliable prevalence estimate data in New Zealand. Back in 2018, the US figure would have probably been more like, I'm guessing, but maybe more like 1 in 50 or something like that. So we're not as far off as the difference between 1.3 and 3%, but still, absolutely, it's a limitation that we acknowledge in the paper and in all the work we do using the method. And I agree, you're right. We're likely capturing a non-representative sample in that those that do get referred are probably going to be on the more complex end of the spectrum. And I guess I alluded to it a little bit in the differences by ethnicity. It's not a population level issue as well. It's specific to different subgroups of the population. So there's a lot of complexity there around that limitation. But ultimately, we don't know until there's some kind of formal validation study, and that's expensive, and we need funding to do that. But thank you very much for the question.
Yeah, that sounds about right. One more in chat, Lifang. Thanks, Nick, for the great presentation. Also, thanks for your presenting to a Chinese delegation a few years back. You mentioned 2 random intercepts in your statistics model. What are these?
Just students nested within schools to capture the different ways that particular schools might go about recording attendance or type of non-attendance. So just that clustering of students within schools was all that captured. And to be honest, it doesn't really change too much in terms of the estimates.
Another one appeared from Hillary. The NZEI has a policy of a teacher aide in every classroom across secondary, 1 to 25 kids. This is for school inclusion and more adults in the classroom. rather than focusing on autistic kids as problems? Will your future research look at such policies?
Yeah, thanks, Hilary. I'd love to. The the challenge, of course, is what is well, if we're using the IDI to do these things, what's captured in the IDI and what's not. But I need to sort of get up to speed a bit more on this new policy and the new initiatives from the government. But whether you can sort of look at some kind of natural experiments of cut points in time when different policies come into play, it could be interesting to look at the effect of those.
That's a good point because your qualitative study will really open up the timeline you're able to look at.
Mm.
Yeah.
Yeah, I think like, as much as I love doing IDI stuff, and I guess everybody's here because they do too. I think the more I do it, the more I realize that a qualitative lens is pretty critical in understanding everything better and then ultimately informing policy and change.
Yeah, the mixed methods approach is probably going to be more important going on, isn't it?
I see this question here as well about mainstream, I guess, versus specialist school enrollment. We ran a sensitivity analysis in the study where we excluded or we looked at mainstream only just to try to get a sense as to whether the findings were being impacted by the type of school enrollment, and there wasn't any substantial difference, which was interesting, I thought.
Awesome. Thank you. Thanks, Nick, for the very interesting presentation. I've got one question. Maybe you've looked into it. I'm not sure. So, did you try to figure out homeschooling? Because, like, from what I know, homeschooling is one of those options. Many who have that issue and they find that school doesn't give the sufficient support for their children, that they actually then consider do homeschooling as an alternative. So actually in the sample you might be using these one, then might just leaving that cohort. So
Yeah, we haven't looked a great deal at homeschooling, although I'm trying to open up a quick draft of a piece of work that we've done recently. I think all I can say to that is that the rates of homeschooling for autistic students are about double, I think. Yeah, so this is 2019 data. We found that 2.2% of autistic students are homeschooled, and that compared to 0.9%. But beyond that, when we haven't looked at that in any more detail, but I think homeschooling and is it Te Kura as well, the online schooling are two things that we've had requests from community to look at it a bit more. So it could be an interesting thing to look at. Yeah, thank you.
Awesome. Brilliant. Thank you.
Yeah, thinking about the idea of that coming online in 2019 would also have been a different kettle of fish in the subsequent years with so many people teaching at home and the online teaching, as you say, which would have no doubt had an impact on that area exactly. Okay, a couple more that have come into the chat. Hillary just says, it's only an idea or a wish at the moment and nowhere near reality. I don't mean to speak for the NZEI.
Gotcha. Yeah. Yeah, thank you.
And one more from Ali, Te Kura Correspondence School would be another interesting school to look at alongside homeschooling.
Yeah, so we haven't done that yet. I'm hoping to do that just to get a breakdown of the percentage of students enrolled in Te Kura. It's been a suggestion from someone else in the past as well. So we'll add that to our a paper that we're just doing a very broad overview of a range of education outcomes that hopefully will be submitted in the next couple of months.
A lot more to think about. Sharan.
Hi, Nick. I just have one question. Like what you mentioned when introducing, you said that about the criminal justice system, like, kids ending in there. So I think we don't have the data yet to track down from the time of school attendance and them ending in in criminal or committing some sort of a crime. Do you have any data from any other countries, what it says about autistic children ending up in the criminal justice system?
Yeah, good question. I think it's a complicated one, right? Because I think a lot of the autistic people that end up in the criminal justice system probably were not diagnosed until they got there. We wrote a paper on it using New Zealand data, and found that autistic people were underrepresented in the criminal justice system in New Zealand. But that was based on our method of identifying autism, which, as we've touched on, you might be biased toward a higher complexity, and in theory in New Zealand, higher complexity will often mean co-occurring intellectual disability, which in theory in New Zealand those young people should be diverted out of the criminal justice system. So I think it's quite complicated, a complicated area. There's a lot of misconceptions around autism and likelihood of engaging and interacting with the criminal justice system. There's a lot of high profile sort of cases that can skew people's thoughts on it. I guess ultimately where I'm going with it, I'm not sure that there's a lot of consistency with international evidence around that. But what I would like to look at here is the extent to which school attendance or non-attendance could change paths for autistic people in New Zealand. I think that's a broader question for the general population as well.
A reinforcement in the chat from Kathleen. It will be great to look at ND children more broadly and whether schools can code students as ND even without an official diagnosis. There is a spectra for neurodiversities, so definitions are important.
Yeah, I mean, obviously from an analytical perspective, the more information on diagnoses or identities would be great. And I think education is a place where a lot of countries have data on neurodevelopmental conditions, but yeah, New Zealand we don't.
Did you look into the parental background, like income? Because like it's kind of like for those diagnoses, you often have to observe it yourself as a parent, whether your child might be on the spectrum or not. And it might be related to the educational background, financial background of the parents, and therefore, like kind of the school attendance might be then in a certain way better than actually for the autistic population itself.
Yeah, no, it's a really good question. And no, we didn't in this paper. We didn't include either social, or I guess we captured socioeconomic status through deprivation, area level deprivation only, but no family level measures of either parents' qualifications or parents' income. So I agree that would be really interesting to look at. This whole paper was supposed to be a really quick, easy paper to do, and it's probably ended up being the longest paper I've ever been involved in to get it to publish. That's why the data's so old. But yeah, the set of covariates we used were just really basic, based on an existing cohort that we'd created prior. So I agree, it'd be really nice to include that next time.
Well, that was a really great question session as well. Always love to see your answers were so immediate and detailed, Nick, that, as I said, your real expertise in this field is very much appreciated.